Dr. Peter McCullough. Now, Dr. McCullough, he's all dressed up for me today because he's got a hearing in Washington. He's going to be testifying. But, you go back to COVID, and all the times we had Dr. McCullough on, every time I had him on one of my YouTube channels, they banned him. They called him a conspiracy theorist. Every single thing that Peter McCullough said in 4 years has been 100% right, 100% accurate, and all borne out. So it's Dr. McCullough 1,000, everybody else 0. And he's joining us now. He's going to be testifying today. Doc, Anthony Fauci testified in a landmark hearing, and we hear he evaded over 100 questions about COVID. Tell us about that and what your expectations are in your testimony today in Congress, Dr. McCullough.
I was disappointed both in the House Select Committee and she answered, John. The House Select Committee had a wonderful opportunity to ask Fauci about his involvement in the creation of SARS-CoV-2 with Dr. Ralph Barrick at the University of North Carolina, Chapel Hill, Peter Daszak at the EcoHealth Alliance, and Dr. Xingling Li, the bat lady in Wuhan, China. They all conspired to create SARS-CoV-2 prototypical virus, and they published it in Nature, Medicine, and Proceedings of the National Academy of Science in 2015, 2016. I messaged that committee over and over again. I said, stay on these papers. It's gain-of-function research. It's clearly out of bounds. And Fauci is at the center of the creation of SARS-CoV-2. Instead, they asked him about 6-foot social distancing. They did get him to concede that the whole purpose of creating these biological threats in these biolabs is to create vaccines, which is what people thought. But I was enormously disappointed. Largely, Fauci skated away.
So why the softball questions? Why didn't they press him? Why, in your judgment?
Yeah, I have to believe at some point in time the government itself has culpability for the creation of the pandemic. The virus that got the whole world sick, it got you and me sick and everyone else. And at this point in time, there is, in a sense, a conspiracy to cover this up, to give it a kind of a window dressing, that there is choreography going on in Washington, but no hard questions, no accountability, nothing that brought Fauci to be more accountable, or Dr. Ralph Barrick at the University of North Carolina, Chapel Hill, or Peter Daszak at the EcoHealth Alliance, Francis Collins, Fauci's boss. So I tell you, I plan to take a different approach today in my testimony on the Hill.
And what will that be, Dr. McCullough?
I want to let the House of Representatives and the country know that we know that nefarious actions were taken to create SARS-CoV-2, the virus, in the Wuhan lab, a U.S. project, and then to railroad vaccines on the population. That was essentially what happened, and both of them caused harm. That we will need investigations to get to the bottom of it. We will need accountability. And I'm going to make it clear to the House of Representatives and really to the nation at large that our U.S. FDA has gone rogue, that it is off the rails. Our FDA commissioner, Dr. Robert Califf, is actively promoting vaccines for off-label indications. Recently, Califf said and promoted COVID-19 vaccination to reduce hospitalization and death, which it doesn't do. The vaccines don't do that in randomized trials. And recently said that the vaccines help prevent long COVID. It's just the opposite. The vaccines make long COVID worse. These benefits of the vaccine are not even listed in the consent form. We cannot have our FDA out there promoting, biopharmaceuticals. Our FDA is supposed to be unbiased and a safety watchdog. Instead, our FDA has become an arm of the pharmaceutical company advertising campaign.
Well, part of what you're saying here, many of us, and everybody knows I don't do conspiracies. I'm not a conspiracy theorist. I don't involve myself in any of that. But I got to tell you, I have thought from the beginning, and so have you, that this whole thing, this whole virus thing, was basically a function to get mail-out ballots to beat Trump. And every day that goes by and more information comes out, that becomes a more realistic theory. You know, I was in those White House meetings. I was in those briefings with Mike Pence and Deborah Birx and her follow the science and her spreadsheets, and you know, I was through all that. And these people never answered I would ask them a question. They were like 0 for 50. They never answered any legitimate question. And all she would say is, well, we're going to follow the science wherever it takes us. And it's like, what science? like tell us what that is. So I'm so glad that you're trying to get to the bottom of this, because I think history is going to show there's something about this whole thing that I think was politically motivated. And eventually this is, every time it comes out, like Fauci goes in, he doesn't answer 100 questions. If he had nothing to hide, he'd answer them. That's really the issue as far as I can see. Going forward, so in your hearing today, you outline what you're going to say. What is your objective now with this? What do you want? What do you want the outcome to be, Dr. Peter McCullough?
Congress needs to be given an action plan. It's obvious they haven't found their own yet. And the action plan that I'm going to propose is that Congress, using the 5 committees that it has that have some degree of oversight over the FDA, that all 5 of these committees convene, or at least the chairs of the committees convene, deliberate on this, and then the Congress make a formal proposal to the FDA that the FDA remove the COVID-19 vaccines and the boosters from the market, all of them, because they're not safe for human use. That'll be the conclusion of the testimony. And then make this very public. The FDA then will have external pressure on them. Now, the FDA directly reports to Health and Human Services, that's Xavier Becerra. They should also get pressure from all pressure points they possibly can. And that the public will know that Congress is not supporting the vaccines. You know, our hearing is led by Marjorie Taylor Greene. She's made it very clear. She thinks Fauci ought to be in jail, that these vaccines are not safe. She knows it. Other representatives who join us, will review the data and see this clearly. You know, we have 75 candidates at the state and federal level and 60 elected officials right now, 1 Florida Surgeon General, all calling for the COVID-19 vaccines to be removed from the market.
Look, this, and there's still, I was commenting the other day, I live in Pittsburgh. I'm in Iowa now, obviously, but I'm still seeing public service ads paid for by basically, the local Allegheny County or Pittsburgh government or the state of Pennsylvania. Somebody's paying for these ads telling you to get your 3-day-old infant a COVID shot. I mean, it's insane beyond belief. They're all tied in. They're all making money. It's on taxpayer dollars. But I just got to go here in 2 minutes. But I got to tell you, Dr. McCullough, you're going to get down in history, I'm telling you, as one of the great heroes in U.S. medicine, because you've been right about this stuff from day one. You put yourself at risk, your family at risk, your practice at risk, everything, and you have nailed it. And one of the other things that you guys came up with, which I love, I don't go anywhere with it without this, and that's your wellness kit. This has been developed by Dr. Peter McCullough. Everything is here. Look, if something goes down with you, like we're on this RV in the middle of nowhere in Des Moines in the middle of a blizzard, you think we're going to get to an emergency room with illegal stacked up out the door? You got to wait now 3 hours for those getting indigent care. But tell you what this emergency medical kit does, right? Everything is here. There's a guidebook. It's all at your fingertips. It's got the Z-Pack. It's got ivermectin. You get COVID. You get the flu. You get bit by a spider. You get a snake bite. Anything that goes wrong, it's on, and there's a guidebook with it. You got to consult with a doctor. We all do that. But all you have, every household needs one. I got 3 of them. One for the office, one for my home, and one here in the RV because I got a bunch of people. We got to take care of them if something goes down. All you've got to do, folks, this is the best thing you're ever going to buy is go to TWC. Put this guy's right up on the Chiron. Go to twc.health, twc.health/Godzilla, twc.health/Godzilla. Promo code Godzilla. You're going to get 10% off. And Dr. McCullough, I think this is the best thing you guys have ever invented because everything is here. And so when you look at what's going on, the risks that people have, that you need immediate care, it's all here with a guidebook, tells you exactly what to do. Good luck now going to an emergency room, average wait 3-4 hours with all the illegals. You can't get in. This is your best bet. Dr. McCullough, thank you. Good luck in your testimony today. twc.health/Godzilla. Promo code Godzilla, 10% off. Coming up next,